do want you to keep in mind that this isn't meant to be medical advice. Some of this stuff is my opinions. However, I've researched this quite a bit. Okay, I got into this originally because I went through a period in my life where I experienced major depression, crippling to the point where it was almost suicidal. And it got to a point where I just had to get out of this state of mind. And so I slowly sought out different treatments, and it's quite a long journey. But I've come a long way from that and found ways to eventually completely manage it, and it is completely manageable condition. Now, if we're focusing around teens and adolescents, these are some of the symptoms you will see with depression. But if you have any kids or grandkids, this might be of particular interest to you. Here's some things you might look for. Depressed mood, particularly in adolescents and teens, one of the things that you'll notice the most is they might not be as interested in activities that they used to be interested in. Maybe they're not playing sports anymore, they're not going out with their friends. It can be as subtle as that, and that's the really scary thing about it. Sometimes it can progress really quickly to suicide. So if you're noticing any changes in your teen's behavior or anything like that, it's certainly worth getting evaluated or trying to sit down and talk to them. We'll talk a little bit more about that pretty soon here. Now, if you were to just take a guess in the United States alone, in the last decade, how much would you say it has increased by a factor of 2 times 10, or decreased 2 times? I guess I kind of gave that away a little bit. 2 or 10, I guess.
10.
That's right. It's about 10 times in the last 2 decades. That's astronomical. Of course, there are more people seeking diagnosis and things like that, but just the numbers alone is very frightening. If we look here, for instance, 11.5 million of 33 adolescents between the ages, I believe it was, 12 to 17. If you do the math on that alone in the United States, it's almost 4 million people in a given year. It's a lot. And as I mentioned in the video, we have the National Alliance on Mental Illness. They look at kind of the overall healthcare system, particularly around psychiatric conditions, and it was rated a D in 2006. And in 2009, it was also rated a D. The way that they look at that is just access to care, how we're doing, how people are recovering from illnesses. It doesn't just cover depression, it's a lot of other things. So if we have such an amazing society here, and we're making all these advancements, why is depression not getting any better? There's a lot of different reasons for that, and one of the biggest things is the stigma that we have about the illness, and people are afraid to seek treatment. If you look here, this is just a little interesting image I found online from the Center for Disease Control. They have this is divided up the United States as far as, if you look here, the very dark colors are some of the states that are experiencing the highest depression. Now, Michigan, we're not doing too well here, and part of that is likely to do with seasonal affective disorder. Of course, there's stuff going on with the economy too, but that's another thing to keep in mind. Some people manifest depression more in the winter months because they're not exposed to sunlight, and it's a very real thing. I'm not really sure what's going on out here in California. They got all the sun in the world, but that's a whole other mess of problems. I'm sure you guys have some ideas. Why should I care? You know, this is why I care. This statement here alone is why I care. 15% of those who are depressed will commit suicide, and that's just astronomical, and it's not acceptable. So we need to start looking at addressing this problem. Now, what do you think what are some of the reasons you guys have heard causes depression? You might not have experienced this yourself, but maybe a family member. Keep in mind that one in 4 people will experience this sometime in their life.
I'd say D.
Yeah. It's a very complicated thing. There's genetics involved, there's environmental situations involved, how people are raised, things like that. And you hear a lot about the chemical imbalance in the brain. While we believe that there are neurotransmitters involved for sure, you might have heard of serotonin, things like that, it's kind of controversial how much that actually plays a role, which is the basis for most antidepressant drugs. So I want to keep in mind, when you're looking at people with depression, we want to emphasize that it's an illness and not a character flaw. It's really alarming. I don't know if you caught that statistic in the video. It said 54% of people view depression as a character flaw. And typically anxiety goes along with this. It's very common for people who are suffering from depression to also have anxiety. Okay, now these are some different things that you can do if you are depressed or you know somebody who is depressed. Particularly with teens, it's quite difficult to get them to want to be getting treatment. But these are some different things you can look at. I think in your packet, if you look at those, I have some of those outlined in there. And so I won't go too deep into these, but I'll just kind of breeze over them here. As I mentioned, about 80% of people who are depressed aren't seeking any treatment. Antidepressants alone, it's a frontline treatment that we use nowadays. Actually, 10% of the U.S. population, about 27 million Americans, are currently using antidepressants in a given year. And that's double the amount since 1995, so it's astronomical right now. If you were to take a guess at antidepressants alone, if you were just to have antidepressants and not any other form of treatment, what percent would you guess provides lasting relief for people suffering with depression? Yeah, it's about 35 to 45%. What tends to happen with these drugs after a period of time is they work, and after a while, this is actually a clinical term that we use called the poop out response, and it's just, I know, I didn't come up with that. I don't know, psychiatrist with that one, but sorry if I offend anybody. You know, it's very interesting. They just kind of stop working because with antidepressants, the human brain is so complicated and we don't really understand exactly what we're doing yet with these drugs. They're kind of, I guess I would say they're kind of sloppy in a sense that we're just kind of throwing out some chemicals, okay, we're going to do this to serotonin and hope that it works, which is the basis for a lot of these. And I'm sure in the future we will develop a lot better drugs. But at this time, that's kind of what I'm talking about here. They just aren't working that well. But I don't discourage people from taking antidepressants by any means. If you are finding it helpful, you know, this is something you have to talk to with the doctor. Depression's a complex puzzle. It usually takes multiple types of treatment to help treat it. So it's a degree of trial and error. You have to try a lot of different things until you find something that works. One of the best things that's helped me over the years and helped me completely recover from this was cognitive behavioral therapy. And this can be done by a licensed counselor or a psychologist or a psychiatrist, and it looks at the thought patterns. This is a big underlying factor in depression, the way that people think. I don't have like a very good source on this, but I've heard that the average person, someone who's not depressed, has about 200 negative thoughts a day. Now, I mean, if you just about themselves, you know, just kind of constantly, we have such high expectations in this society that you were to take that and compare that to what a depressed person thinks, it's very detrimental to themselves because they're constantly putting themselves down, and that leads to a lot of depressive symptoms. And cognitive behavioral therapy alone can address a lot of that. Just changing the way you think has amazing results, and I'm sure that you know that. Exercise has been shown, of course, to help a lot with depression and anxiety, as little as 10 to 15 minutes a day. A lot of things to support that. Diet modifications is huge. It would take me hours to get into this, but just basically cutting out a lot of the crap. And I mean, that's what it comes down to, and just eating whole foods.
Processed foods.
What's hard, it's very hard to do in our society these days. I mean, this is a great example. I don't know if you guys remember this recently, Taco Bell being in the news about, now, eat Taco Bell, that's cool with me. I just want to point something out here. I mean, this is the taco meat filling. that's in there. I just for 1 second, let's look at this. Silicon dioxide. Do you guys know what that is? It's sand. I mean, this isn't our food. I mean, we really don't think that has some kind of effect on mood. I mean,
Didn't our parents tell us you gotta eat a cake of dirt before you die?
I just, my point is that it's just, this kind of stuff is going to have an impact on it. And so educate yourself. Look at this kind of stuff. Do a little reading. Look at your diet and what you're eating. If this is a great book. It's not about depression, but it's about In Defense of Food. It's called In Defense of Food by Michael Pollan. He writes a lot on whole foods and kind of the direction that our society is going with the food system. Bright light therapy is another really good one. There's been a lot of research on this. You can take, actually it's a medical light that you put in front of you, sit in front of it, and you don't look directly at this light, but the stimulation from the light actually helps a lot with depression and other psychological conditions. Omega-3 fatty acids, you've probably heard a lot about fish oil. This isn't just good for depression, it's also good for heart disease. Particularly, that's one of the biggest things that they've researched is heart disease, cholesterol, controlling cholesterol. And maybe you tried it, didn't work that well. You might want to try different dosages and look at some different brands, because that's the problem with supplements, is quality control. A lot of these will be in your packet that I gave you guys. Social isolation, that's a difficult thing, especially for teens. It's like having the flu in your mind, in the sense that your body has the same reaction to any kind of illness. You just want to crawl up in a little ball, and they want to do the same thing with depression. Now, maybe that's not a bad thing with the flu, because your body needs time to recover. But with depression, it's only going to make it worse. So encourage your teen or whoever is suffering from this to try and get out, try and push them to do things. Even if they act like they don't want to, it's important that they do. Mindfulness meditation, there has been a lot of research on this. This is a great book. I'm trying to remember the guy that's done, Kabat-Zinn. He's a professor, I want to say somewhere, Philadelphia maybe. Anyways, he's done a lot of research on this, and if you're not familiar with mindfulness meditation, it comes from Buddhist principles, and they look at, it's basically being aware in the current moment is how I would describe it. It's hard to really sum it up in a sense of a few minutes here, but it's just taking time. It doesn't necessarily mean you have to go lock yourself in a corner and just turn off all the lights. Mindfulness meditation could be, I'm just focusing in on the hum of this fan, and I'm just focusing in on that. Typically what we do is we focus on our breathing, and that gives you an awareness of what's going on inside your body. And then you can start to pick out these depression symptoms much easier. Spirituality plays a large role in healthcare, in recovery of anything. If you have belief that you're going to get better, whether it's through God or whatever your belief is, there's a good chance that it may help you along. So whatever your beliefs are, it could help. These are some other things I've picked up over the years. Pet therapy. Don't give up. People, dogs, cats, whatever you have, wonderful for something like this. Don't give up if a particular treatment doesn't work. Try different things. Read books, a lot of them. Talk to other people who are depressed. If someone they're depressed, encourage them to seek treatment. Read books on the subject so you understand it. Be patient. Understand that it's not their fault. Recognize little bits of progress, because it will be a trial and error and slow process. Push them to get involved in activities, like I said, and try not to overwhelm them. Make sure you take care of yourself too, because you need a good support system when you're going through depression. However, those people need to take care of themselves too. Don't tell them to snap out of it. Don't tell them they're being a baby. Don't tell them it's not real. Don't tell them anything like that. It's just not, it's counterproductive. It's not, you know, everybody goes through hard times, but this is something that people deal with for long periods of time. You know, where do we go from here? You know, I hope that you can understand from this presentation that it is a serious problem. I know it's early. I know this is a lot of information. There was a lot on those slides. I usually do this over an hour. But, you know, I was glad I was able to get in as much as I could here. So at this time, I'd like to take any questions you guys might have about depression.
You didn't mention anything about bipolar.
Sure. What would you like to know?
Well, my wife and I had 2 sons that committed suicide.
Okay.
And both of them were bipolar severely.
Okay.
A lot of what goes on in our environment, whether it's the criminal justice system, whether it's the medical profession, don't recognize it or can't deal with it. I mean, it's all well and good to be able to know what's going on, but it's hard to get that individual who's going through that struggle to either take their medication or do any type of regimented type thing. So being able to recognize it, but you know, the whole support system for that out there is probably non-existent to some extent.
Particularly in bipolar disorder?
Particularly, yeah.
Yeah, I would agree with that for sure. And yes, these certainly overlap. I'm sure, as you're aware, there's the different types of bipolar disorder, and the manic depressive, for instance, people
Right.
go through roller coasters of emotions, and they have very high highs and very low lows. So it overlaps a lot with this. This definitely crosses bridges over into things like bipolar disorder, and we need people out there looking at this, and we need people thinking about, of course, bipolar disorder too, definitely.
You're a little bit young for this, but for many of us in this room, we can go back to the Ozzie Harriet time frame of the 50s and the functional disorders of the family life, where families used to sit together at a dinner table and eat together. Now, with society's changes, more competition against the individual's time and time frames that they have available to them, and now the capture of all this independence of sitting and staring at a little box, whether it's a telephone or a game, that independent position there, and the lack of socialization.
Absolutely.
That correlation is my assumption of what also contributes to that high rise.
I would agree with that, and I've definitely seen a lot of evidence to support that too.
Chris, how can you tell when someone's crossing the line from having a bad day to having an illness called mental depression?
Yeah, that's a good question. Well, typically, you know, if it's going on there are different types of depression. There's situational depression, which could be from the loss of a loved one, which can go on for several months. So it's difficult. But if it were just under normal circumstances, like I said, are you referring to just anyone in general or teens? Because it does.
Well, I'm thinking of teens.
Okay, in teens, I would say some pretty consistent changes in their behavior, in things that they enjoy to do. If they just don't want to do those for several weeks in a row, there's a good chance that they may be experiencing depression. That would be one of the biggest indicators to me.
You know, you were talking about the negative thoughts and living up to expectations. You know, I grew up in the Ozzie and Harriet, era too, and my family did not resemble them at all. And so I think part of our struggle with this is that we do try to say, why isn't our life like what other people's lives are? Now, there's the flip side, like the Kardashians. We don't want to be like that either. But, you know, I mean, but the fact is that, you know, we're living up to expectations that are put to us in the media. Does this seem to be a leading indicator or a leading cause for this sudden rise in depression, or do they not?
Can you rephrase that again a little bit?
Well, you know, the media bombards us with these
Right.
messages about what we should be.
Sure, absolutely.
And so we're constantly saying, well, why aren't we there? We must be a failure in life
Yes.
because our lives aren't like this.
Yes.
And that has been steadily increasing over the last 50 years, especially
Yes.
in television. Has this been proven to be pretty well connected to?
Definitely. I think with all psychological disorders, you know, you look at bulimia and different disorders like that, eating disorders, we know there's evidence to support that, and I'm sure that it crosses over to depression too. I don't know of any studies in particular, but I'm sure it does.
I get a little upset when the 20-year-old's driving a Beamer, and I don't have one. You know? Don't get upset.
You going after a while?
I've been going on for a long
We haven't
time.
noticed any changes in behavior.
Did you have a question?
Actually, it's probably more of a statement, because this is, I was in this business for a long time.
Okay.
And I just wanted to say that one of the, all these things like the family and all that, they, in my opinion, they have something to do with it. But when a person is clinically depressed, it goes to a different level with them. It's not something that just bums them out, it's something that they just don't have the facility to get over.
Right.
They don't have they don't have the ability to cope with it. A bad day could be a bad day that, you know, with a little encouragement, a regular person gets through and bounces back.
Right.
I guess, you know, for me, it's always been, how do they respond to the things that help normal people?
Right.
You know, if a person is down and they get encouragement and they get better, that's not depression, that's just
Right.
a life.
Absolutely.
But with clinically depressed people, they can't. It's not that they won't, it's they can't get over it. You can encourage them till the cows come home, and they can't. And it's unfortunate that science still doesn't know why they can't do that, because everybody wants to just say, well, you could if you tried.
Absolutely. I agree. You need a very strong support system, people pushing you the whole way, and getting you into the treatment.
We've touched on situational depression all the way up to bipolar in adults, and you had a lot of different ideas. With situational, eventually you do what she was saying, you just kind of move it over, but it takes sometimes years.
Oh, yeah.
So in that case, do you still see the other kinds of help if it's just situational?
Absolutely. I've looked at a lot of these things, like the mindfulness meditation, the diet, and things like that. In acute clinical depression, antidepressants can definitely help. And that can be with situational depression too. And a lot of these other things can carry over into different forms of depression. Definitely situational depression too.
So then, all the way to the other extreme, all those would help bipolar too then?
It's possible. I'm sure that it's possible. I would look into them. I know that there's a lot of evidence to support mindfulness meditation in bipolar disorder. Thank you.
Chris, we want to thank you for your excellent presentation, and on your behalf, the club would like to make a donation